vagus nerve is completely overlooked. The vagus nerve is the connection of the neuroimmune system. It's how the brain and the immune system talk. When the vagus nerve is dysfunctional, the immune system goes into fight mode. We cannot heal when these immune cells are stuck in fight state. There are connections to virtually every chronic disease with regards to vagus nerve dysfunction. If we don't feel safe, we can't turn on our vagus nerve.
Welcome to the Uncover Your Eyes podcast. I'm your host, Dr. Meenal Agarwal. Here's a number that you need to hear. 90% of people today show signs of chronic nervous system dysregulation, and most have no idea. Poor vagus nerve function is linked to anxiety, depression, digestive issues, autoimmune disease, high blood pressure, inflammation, and even mortality. Yet no one is checking the nerve that controls it all. Most people think they're stressed, but the truth is far scarier. Their vagus nerve is failing, and their brain, gut, heart, and immune system are paying the price. That's why I brought on our show today the world's leading expert on vagus nerve health, Dr. Navaz Habib. He's also known as the vagus nerve doctor. He's the best-selling author of Activate Your Vagus Nerve and Upgrade Your Vagus Nerve, and the creator of the Vagus Protocol. This episode is going to be a wake-up call for many of us. Thank you, Dr. Habib, for being on today. I really appreciate that you took the time out to come today. I know you're busy.
It's my absolute pleasure. I'm excited to be here with you.
Yeah, so tell me, I was saying to you earlier, I don't think we've ever talked about the vagus nerve. I never talked about it in all my years of practicing or through schooling. I think it was a 1 second mention in a lecture. So, tell me about the importance of it and what it is.
Yeah, absolutely. The vagus nerve is completely overlooked. And I think what we need to really start to do is understand things in a little bit more holistic manner. And even the naming of the nerve is probably the reason why we didn't dig into it. It's actually called the vagus nerve due to its wandering nature. So when it was initially found by anatomists, they realized that this nerve that comes out of the brainstem, it's one of the 10 or 12 cranial nerves. It's the 10th of the 12 pairs of cranial nerves that come out of the brainstem. This one was unique. It literally came down along the neck, had a few branches in the head and neck area, just like all cranial nerves do. But this one went down and went to virtually every single organ in the rest of the body. And it was to these anatomists that are looking at everything from a very macro perspective, it was vague. They weren't sure what it did, right? It connected to the stomach. It connected to the liver, to the small intestine, to the large intestine, to the pancreas, kidneys, liver, like you name it, every organ, lungs, heart, all had a connection to this nerve. So that's probably why we've tended to overlook this nerve for such a long time. Recently, and in the last kind of 20 to 30 years, we've actually, through the use of microscopic technology, been able to understand the exact cell types that are communicating between those organs and the vagus nerve. And it happens to be immune cells. The vagus nerve is the connection of the neuroimmune system. It's how the brain and the immune system talk. And the immune system we tend to think of as being the spleen, the thymus, and a few glands and lymph nodes, and maybe that's about it. We have immune cells in every single organ of our body. Immune cells are the first ones to differentiate. When we're an embryo, when we are cells that come together in mother's womb and we start to grow, these pluripotent stem cells, these stem cells that have all of the potential in the world to change into anything, the first cell they change into is immune cells. The immune system, I think, has also been misunderstood. In my opinion, and what we're seeing in the research, the immune system does a lot more maintaining and building and supporting the function of every single one of our organs. And that is something that we've missed out. We've tended to see the immune system simply as being there as a protection tool against threats to our survival, protecting us from physical damage, protecting us from uh, biochemical issues, bacteria, viruses, you name it, even chemical traumas, things like that, the immune system turns on and we react with an immune reactivity.
Right.
What we're now seeing is these immune cells can shift between these modes of being in fight mode and being in fix and maintain and repair and regulate mode. And it's the vagus nerve that signals to those immune cells to shift into the fix mode and the repair mode. When the vagus nerve is dysfunctional, the immune system goes into fight mode. And when it stays and remains in fight mode, because in some situations our vagus nerve has become dysfunctional, the immune cells become hyperactive, they become hyperinflammatory, and we go down the path of chronic inflammatory disease. The vagus nerve has been overlooked because macroscopically it wasn't understood. And now we know that it is the nerve that's necessary to communicate to these immune cells to regulate themselves, to shift from fight state into fix, repair, regulate, function state. And that parallels the autonomic nervous system. The autonomic nervous system is what we call the system of all of the things that happen within our bodies that we don't consciously need to think about. I'm not consciously thinking about beating my heart. I'm not consciously thinking about detoxifying my blood. I'm not consciously thinking about creating urine and
Mhm.
putting it into my bladder. But these things are automatically happening within the body. These are all processes that are automatic. Now, we have two sides to this autonomic nervous system. We have the sympathetic side, which is what we know as the fight or flight side of things. And then we've got the parasympathetic side of it, and that is what we know as the rest and digest side of things. I'm adding one more word to that because the vagus nerve runs the parasympathetic nervous system, and it's the rest, digest, and recover system. It enables healing. So, what does all of this mean? I realize I've thrown a lot of science out here in the first 5 minutes of our talk. I want people to know that when you have a well functioning vagus nerve, you are able to send good signals to your immune cells to turn them into fix mode. When you don't have a well functioning vagus nerve, you send more signals to the sympathetic nervous system. We turn on the fight or flight mode, and these immune cells go into a state of fight and they become inflammatory. And what we need is a well functioning vagus nerve to be able to regulate that fight mode, turn off fight mode, and shift to fix mode. We can't heal when we're stuck in sympathetic state. We cannot heal when these immune cells are stuck in fight state. We need to be able to create a shift, and the vagus nerve is the crux to enable that shift to occur.
Navaz, when we loosely say that 80% of our, vagus nerve signals send messages to the brain versus not the other way around, what does that mean?
It means exactly this. The immune cells are actually talking through the vagus nerve to the brain. That's where the vast majority of signaling is coming up from. In fact, we're far more aware now that it's actually the microbiome that is the primary driver of vagus nerve function. The bacteria, parasites, viruses, yeast, and worms that are present within the gut lining or within our gut lumen are constantly talking to the immune cells that are present one cell layer deep, which are our tissue resident macrophages in our intestinal walls. And they are signaling to the brain what's happening within the gut. And the gut is the primary area where all of our nutrients come in, and it's the primary area where the majority of our toxins can enter. Gut health is huge and it's completely overlooked. That's where functional medicine, that's where a lot of these lifestyle
Mhm.
approaches is going, is let's look at your gut health because that's driving whether we're going into this fight or flight state or not. And this is where the primary source of biochemical toxins are. So we really need to look at the microbiome and talk about exactly what signals are making their way up to the brain. Now, in the same way that a CEO of a company needs to get good information from all of their teams, from their sales teams, from their CRM teams, from their marketing teams, from all of the legal, they all need to talk to the CEO, and the CEO needs to make really good decisions. Well, in our bodies, the brain is the CEO, and the vagus nerve is bringing these signals from all of the other organs, all of those contributing pieces to this hierarchy structure to the CEO, so the CEO, the brain, can make a good decision. The vagus nerve is involved in bringing the vast majority of these signals up to the brain. If we can't get good signals up, can the CEO of a business make a good decision with bad information?
Mm.
In the same exact way, our brains can't make as good decisions because we're stuck getting bad information. This is a huge piece of the puzzle. So
So
80% of the signals are
cognitively,
coming up.
so
Yes.
cognitively, what does that mean? Does that mean that the brain is just not, functioning, and maybe that's why we're seeing early cognitive diseases? What does that mean? What are the
That's a
consequences, I should say?
it's a big piece of the puzzle. So yes, cognitively we're seeing neurodegenerative diseases picking up steam. We're also seeing metabolic conditions, autoimmune conditions picking up steam. But from a cognitive standpoint, what we're noticing more often than not is with lower HRV, which we'll get into as a measure of vagus nerve function, what we're noticing is we are leading into situations of brain fog, significant fatigue, lack of cognitive clarity, lack of good decision making, memory issues, sleep disturbances that dysregulate hormones. A lot of these play a huge role, but if the signals don't get up to the brain effectively through the vagus nerve pathway goes through the brainstem, specifically through the nucleus of the solitary tract, and then up to the locus coeruleus, and then vastly throughout the rest of the central nervous system, the brain in particular. But there's specific signals, and there's one area in particular, actually two areas in particular that I want to lean into. Number one is your hypothalamus. Your hypothalamus gets a lot of information from these immune inputs through the vagus nerve. And the hypothalamus is where we then start making decisions on what to tell the pituitary gland and the adrenals, and the pituitary gland and the thyroid, and what to do from a gonadal standpoint. So hormone regulation comes into play here pretty significantly. And then via the hypothalamus, we also have connection to the hippocampus, which is important in memory and memory function. So if we are forgetting where we parked our car, or we're forgetting certain things on words or different things, and I'm literally doing it right now during this podcast with you, forgetting words. These are situations where the hippocampus isn't being fed good information because vagus nerve signals are down. The big one, though, is another area in the central nervous system in the brain called the nucleus bacillus of Maynard. There's a direct signal from the locus coeruleus to that spot. And in that nucleus, and we don't need to remember all of these terms, but that spot is where we produce acetylcholine. And acetylcholine is the primary signaling neurotransmitter of the vagus nerve. In fact, it's the only neurotransmitter that the vagus nerve uses. And when we produce acetylcholine, acetylcholine is the tool that then signals to immune cells to shift into fix mode, to come out of fight mode and shift to fix mode. Guess where else we have these immune cells? We also have these immune cells in our brain. And we have to signal to the immune cells specifically. They're called astrocytes, oligodendrocytes, and microglial cells. And these three cell types in our brain, when they're stuck in fight mode, are the cause of these neurodegenerative diseases, right? The aquaporin channels of these astrocytes regulate the blood-brain barrier and make sure that we can clear out toxic lymphatic fluid, the fluid that's in our brain. When we sleep, we turn on our lymphatic system. It's like flushing the brain of all of the toxins that have built up through the day. That's necessary. When the toxin levels build up, the microglial cells that are managing synaptic connections between the neurons of the brain, those microglial cells go into fight mode. They break down these connections, and that leads to cognitive dysfunction. We're not clearly thinking as well, right? We're not able to put things together. We're not able to learn as effectively, and that chronically over time is going to lead to Parkinson's, Alzheimer's, dementia, which are these neurodegenerative conditions. It comes down to, if you have good vagus nerve signaling, cognitively, you're going to notice the symptoms of dysregulation of those immune cells, that they're stuck in fight mode. Immune cell regulation is the key here. If you can send good signals to the immune cells, you're going to be able to get over these issues. But if you don't, you won't be able to. And that's where chronic disease picks up.
So, do you feel that the vagus nerve could be one of the main nerves responsible for or dysregulation of it is responsible for a lot of our chronic diseases? I mean, could we even say like diabetes, blood pressure, all of those ones that are common?
There are connections to virtually every chronic disease with regards to vagus nerve dysfunction. Now, it's not the vagus nerve that is the cause, right? Dysfunctional vagus nerve does not cause it. But oftentimes it is a huge and important pathway between the initial root cause and the eventual disease state. And if we lack that functionality to begin with, we're essentially lowering our ability to potentially recover, right? So the amount of stressor, the amount of toxic burden, the amount of root cause that's required to initiate that shift is going to be lower in people that have lower vagus nerve function than those who have higher vagus nerve function.
And what causes, okay, well, I guess, yeah, what causes dysregulation and how do you know it's dysregulated?
Yeah, it's a great question. So it's a very broad question as well. What causes dysregulation in the vagus nerve is the same that caused dysregulation in every other area. The word that I have to use here, and we'll misconstrue it a little bit, but it's stress. Stress is a driver of vagus nerve dysfunction, but only when it's chronic and long term. So, stress, we tend to think of stress in a really psychology, emotional stress, daily stress way. So, you'll ask somebody, "Hey, are you stressed?" They'll often say, "Yeah." But we're really narrowing that stress down into an emotional stress. What's happening in your day-to-day life? What's your bank account saying? What's happening with the kids? What's happening with the car? The traffic is a stressor, all of these things. What about the challenges that you might have experienced as a child or in your past? What if you were the victim of a crime? What if you've had a really challenging relationship with your parents? Those are psychological stressors. Those are challenges that happen in the past that scuff the lens through which you see the world. And so you tell yourself, even though objectively something has happened that may not be stressful or negative, you were
Mhm.
telling yourself the story that it is. So psychology plays a huge role. And really, a big one here when it comes to optimizing vagus nerve function is the feeling of safety. If we don't feel safe, we can't turn on our vagus nerve. Safety is a major psychological driver of vagus nerve activation. So we need to feel safe in order to turn on that parasympathetic nervous system and turn on the vagus nerve that then regulates and puts these signals out that we are in rest, digest, recover, healing mode. Don't forget about physical stress. Physical stressors like, are you moving too much? Are you moving enough? What if you're sitting all day for work? What if you're not exercising or moving because our bodies were designed to move, but you are sitting? And that's something that I used to do. And I've now realized that movement is medicine. Really, just standing up and moving is huge. But some people have been injured, physical injuries, osteoarthritis, osteoporosis, physical injuries, muscle strains. These are physical stressors that are going to build up. And then the last one is biochemical stressors. And these are things like, the fast food, the snacking, the excess sugars, the poor quality fats. These are all toxins that are building up within our body. And now, if you put all of these together, let's say, for example, we have a bucket of the amount of stress that our body can handle, and we start putting emotional stress and psychological stress and physical stress and biochemical stress in that bucket starts to fill up. And we have a certain capacity of stress that we're able to handle. But when that bucket gets filled or near the brim and it starts to spill over, that's where the disease state happens. So your vagus nerve capacity dictates how big that bucket is. If you don't have good vagus nerve function, you're not going to be able to handle as much stress. And that's really where we know that stressors are not going away. We know that stress levels build up, they pick up. We have a lot of stress that we're going to deal with in our entire lives. What we need to do is build up the stress management capacity, the ability to put holes at the bottom of that bucket so the stressors come out in a safe and effective manner. And that's where a lot of the stress management tools that we can get into will be beneficial, is because they're helping to empty out that bucket and build up the capacity of your body to handle stress long term. But that's the big one. How do we measure it? That's a whole
Yeah.
nother thing. So vagus tone or vagus nerve tone is measured primarily through a marker that I mentioned earlier called heart rate variability, HRV. I'll simplify this down. Okay, so We know heart rate. Heart rate is the number of beats per minute. So, number of times your heart beats in a 60-second period, that's your heart rate. Then, when we go and we look at your ECG, which is the echocardiogram, meaning looking at the heartbeat that we all know when you look at the monitors in a hospital or you see it on in a doctor's office, what they're measuring is we're going to start measuring the number of milliseconds between one heartbeat and the next heartbeat. And then we're going to measure it between the second and the third, and then between the third and the fourth. And over a period of time, we're going to get what's a measure of variability. We're averaging out the number of milliseconds between beats of the heart, the difference averaged over a period of time. What we want is we do not want our heart to beat like a metronome. We don't want our heart to beat exactly the same every single time. This may go a little bit counterintuitive to what a lot of people may think, but the reason for this is we're constantly in our heart getting inputs from the sympathetic nervous system, the fight or flight side of things,
Right.
and the parasympathetic nervous system through the vagus nerve to the heart. And what we want is a little bit of acceleration and a little bit of deceleration, and a little bit of acceleration, a little bit of deceleration. It's just like driving a car. You never want to have your foot on the accelerator all the time.
Right.
You want to be able to shift to the brake when necessary, especially when you're driving where, traffic lights and stop signs. You want to be able to stop and go and stop and go. And that's really what we want to do. And so when we have a high level of variability, meaning that we have 600 milliseconds between beats of the heart, and then we have 700 milliseconds, and then we have 600, and then 700. What we have is a variable heart rate variability. And what that means is we have inputs coming in from the sympathetic and we have inputs coming in from the parasympathetic together, and they're telling the heart to speed up and slow down and speed up and slow down. And as that's happening, the higher variability means that the signals are effective on both sides. But a low variability, meaning your heart is beating more like a metronome, very, very rhythmically, means that we're likely lacking the vagus nerve signals, that your heart rate is stuck in a sympathetic mode. And so that's where we can look at this. Now, there's different ways to measure this out. There's time domain versus frequency domain. There's SDNN versus P550, and we don't need to get into all the science of that. But heart rate variability is the best way to identify whether you're more sympathetic or more parasympathetic. And that's how we know whether the stress level has been high for this person. So, what we'll often see is wearable devices are really great at this. So, I've been using an Aura Ring for about 7 years. Whoop Band, there are tons of these things out there. Even like Apple Watches are great for guesstimating where we're at. None of these things are diagnostic by any means, but they're great for trend analysis. And what we'll see is people will wake up and, oh my goodness, my HRV is like 18, very low. Versus another day, I'll wake up and it's 63, and that's really good. Now, that's not super normal to be able to go between those numbers, but the higher your heart rate variability, the better you're recovering, the more vagus nerve signaling you have. The lower your heart rate variability, the more sympathetic state is turned on. And that's how we know whether we're more stressed out. So, on a day when your heart rate variability is generally a little bit lower, maybe you don't push yourself with a crazy workout. Maybe you don't push yourself with bad food choices. Maybe you take that day to calm yourself down. Maybe you do a little bit more breathing practices and stress management practices, and you take it as a recovery day. And that's how we can start to utilize this data point of HRV to dictate how we choose to live our lives or how we choose to spend our time.
Wow, I didn't know my Apple Watch has that function. So, I mean, I think I always just use it to count my steps. I don't even look at that, but that is so interesting. What is what is the Vegas protocol that you have? What does that mean?
I love that you're asking this question because I usually forget to talk about this. So, I've been working with people for about 7 years in working to get their vagus nerves working better. And there's 5 steps to this puzzle of optimizing vagus nerve function. And with the help of our wonderful friend of AI, I've been able to put it all together. I literally threw a massive prompt of all the things that I was thinking and all of the fun tools, and it helped me to create the Vegas protocol. So the Vegas protocol goes like this. It's an acronym with the word Vegas, VAGUS. It is not spelt like Las Vegas. V stands for validate. So validate is identifying what's really happening within the body, getting objective evidence, getting objective data points, objective numbers to help us to know what's happening. So, how can we do this? Blood work, wonderful way to get this done, right? Assessing vision, great way to get this done. Assessing heart rate variability using tools like uh, wearable devices to help identify. Steps is a great way to validate that you're, you know, I'm getting close to my 10,000 step goal. I'm closing my circles. My wife has an Apple Watch, so I get the circle situation. But you want to be a level of active that, and these validity tools are great for helping to do that through these wearable devices. Can you dig deeper? What's happening in your microbiome? What if you could identify through good stool testing what's happening with the bacteria, parasites, viruses, yeast, and worms in your gut? What if you could identify what's happening through urinary analysis as to what's going on with your mitochondrial function? What if you could identify through urine analysis and salivary analysis what's happening with your hormones? Functional lab testing is a great way to help dig deeper than blood work. Validation is key. So identifying what's happening. There's even a couple of great free ways to identify how these things are going, things that you don't need to spend money on. The BOLT score, BOLT, is a really wonderful test that anybody can do. Literally, you can do it in this moment. It's the body oxygen level test. And what you do is you take a couple of normal breaths, and then at the end of one of your breaths, you hold your breath and you measure the number of seconds between when you uh, enter that breath hold until you feel the first urge to take that breath back in. So you're not holding until you're going to die, but you're holding until you feel like I need to take a breath now.
Okay.
And the number of seconds that count goes tells you how tolerant your body is to carbon dioxide levels. As the carbon dioxide in your blood rises, it's going to prompt the need to breathe. Now, if that happens really quickly, it means that you're not super efficient on your breathing patterns. What we want is we want to see over 30 seconds. We don't want to be needing to breathe up until kind of the 30-35 second range. Most people are sitting in the 12 to 15 second range,
That's what I was going to say.
meaning
I was
that
going to say like
efficiency
second
for our
for
breath
me.
is not great. Exactly. Now, what could the breath have to do with vagus nerve function? It really has everything to do with vagus nerve function. We'll get to that, but the breath is really key here. So V is validate. Let's use these tools, and you can measure BOLT score every week. It's a great weekly test, and it literally costs $0 and takes a minute to complete. So it's a very easy test to do. But validation is key to understanding where you're starting and your progress as you go. A stands for activate. And activate is getting your vagus nerve activated. What are the exercises, the stress management tools, the practices that you have included in your day to day life that enable you to turn on your vagus nerve? I dig into them in my books. I've got 2 books. I'm the guy who wrote 2 books on the vagus nerve, and I have a third one in my head. And so, if we want to dig in, what are the exercises that people can do? Humming, chanting, gargling, singing, cold plunge, sauna. Depending on the person, there's a lot of different tools and practices. Creative pursuits is a great way to do this. We want to get you into an activated vagus nerve activated state. And so utilizing these practices regularly is great to do this. In some cases, I'm a really big fan of bringing in electrical vagus nerve stimulation using a tool like this Truvega that I have in my hand, where you can electrically stimulate the vagus nerve in a simple 2-minute stimulation. And so that's a great tool, particularly for people that are in a chronic state or they're having a lot of difficulty with their sleep or managing their stress levels. So, what are the tools? What are the practices that you're including to activate your vagus nerve? G stands for gut brain immune optimization. I realize it's not all G, but we'll start with the gut because the gut is where it all begins. Understanding microbiome health, nutrition, what's going into your body, what's affecting your brain health, your cognitive function, and overall your immune system. So, gut brain immune optimization, in my opinion, it all truly comes down to optimizing your mitochondria. Mitochondria is what we know as kind of the energy centers of our cells, but they do so much more than that. How our mitochondria go dictates how our life goes. So if we want good functioning mitochondria and good long life, that those two go hand in hand.
Right.
That's key to this. So really that's what the whole gut brain immune optimization piece is about, is optimizing mitochondrial function. U stands for unburden. So looking deeper at the other sources of stress. I talked about the four areas: the emotional, psychological, physical, and biochemical stress sources. Let's see if there's other things that are causing you to go into this stress state. What else around your environment? Is there your pantry is full of crap and you're going there at 9:30, 10 p.m. every night? Or what's happening with physical stress, that you're sitting too long, and are you getting your body moving really effectively? Unburdening, essentially taking these things away and minimizing the number of burdens on your body. That's where the U comes in. And S is sustain. Sustain's really focused on creating these positive habitual changes that enable our body to take these new practices and make them habits long term. So, not just doing the activation exercises a couple days a week, but really making these habits for long term sustainability. And if we sustain these practices long term, then we build our resilience. We make our buckets bigger, and we make the holes in the bottom of the bucket stronger so we can manage stress longer term. Comes down to creating habits in a really powerful way. So that's what the whole sustain piece is. Those are the 5 stages of the Vegas protocol. Now, each person is going to be doing well in some areas and really poorly in others. And so I've created a Vegas score protocol scoring quiz that anybody can fill out. I'll send you the link and you can put it at the bottom
Yeah.
of the notes or whatever. But that's a great way to identify, is it more of a validation issue, activation issue, gut brain immune issue, unburdening issue, or is it more of a sustainability issue in your particular case? And then from there, we support our clients through being able to say, here are the few areas, and we have courses and support and health coaching and community work that we provide as part of that. So that's what I've created around the Vegas protocol.
Can I ask you, like you talked about the breath work. Are there any other,
Yes.
like, I want to call it physical exercises to stimulate the vagus nerve?
Yeah, so breath is where it all starts, and all of the other exercises layer on top of that. So the breath is key. As we inhale, we're turning our body into sympathetic mode, and as we exhale, we're turning on parasympathetic mode. We're turning on the vagus nerve. So exhale is key. Our breath needs to be 3 things, and then I'll get into the other practices. So the breath needs to be nasal, through our nose, diaphragmatic, more belly breathing, more diaphragmatic, deeper, slower breaths, and then longer exhales. We need to spend more time on exhale than we do on inhale. Once you practice that, then you can start doing the practices like humming. Humming is a great one. And I really love this because we've tended to put certain practices in religious buckets and not realizing that they actually have really powerful health benefits. So the idea of Om during meditation, practicing Om, what are we doing when we're doing that? We are exhaling, nasal exhale, right? We are humming, we're vocalizing. Guess which nerves activate and stimulate the laryngeal muscles in the throat? It's the vagus nerve. So humming will do that, and nasal breath will do that. So humming is a really simple layer on top of the breath, especially with the vocalization pattern. Om is one of those things that everybody understands that. You know what? That frequency of Om actually has been shown
That's
to
so
increase your
interesting because, I
HRV.
mean, we've grown up with that,
It's
yoga and
crazy, right?
whatnot. And my mom like teaches yoga. And I don't know if I ever would equate that. I mean, to me, it was just, okay, that's where, people did it and that's what they use. But I would have
Yeah,
never thought that it's so interesting to see like ancestors had a thought process.
it's
Probably
crazy.
they didn't even realize down the road that there was
That's
some thought
exactly
behind
right.
it.
Right. And we, as a Western kind of healthcare practice, tended to kind of look these things and say, not so much. Even looking at Ayurvedic medicine and traditional Chinese medicine, we've always been like, I don't get it because it doesn't fit the physical structure and the Western medicine idea. So for me, it comes down to maybe there is some real knowledge and wisdom that is there that we need to take in and utilize and do what we need to with it, right? So humming, wonderful way. Chanting, virtually every religious practice has some sort of chanting or singing hymns and ginans and all of these things. They all have practices where there's some sort of singing vocalization practice. Those are huge. Meditation, massive. Yoga, wonderful. I'm a huge fan of a little bit of aerobic exercise, a little bit of resistance exercise, and mixing it up and trying different things. So I've got my Peloton behind me. That's a couple days a week. I've got the gym that I go to where I lift weights. That's a couple days a week. There's a lot of work that people can do to optimize there. Then I mentioned cold plunge. Well, what happens when you have a cold shower hit you, right? You get in the shower, you think it's going to be hot or nice and warm. Water comes down, it's cold. Immediately you go, right? Tighten up. Everything tightens up. Inhale through the mouth, stressed out, eyes go wide. I need to survive through this. Well, what happens if you do that with the intent of learning to breathe through that? What if that's a stressor that you can breathe yourself out of experiencing the stress with? Now, if you want to layer on top of that, get into a cold plunge. I've done that numerous times. I love it. Really, really powerful tool for helping you downshift, teaching your body to physically handle stress. Doesn't matter if it's physical stress, biochemical stress, emotional or psychological stress. Your body always handles it the same way. It turns your body into sympathetic mode, sends signals to the immune cells to turn on, get into an inflammatory mode. But if you can teach your body through breath and through all of these other practices layered on top of the breath to shift to parasympathetic mode, imagine what you're going to be able to do when stressors that happen outside, you've now taught your body to shift back to parasympathetic. And so you're able to regulate that practice long term.
I have not been able to go into a cold plunge yet, so I got to train my vagus nerve. I want to talk about the manual stimulation. Like, you showed us that device. Like, what are there other options or these
Yeah.
devices like this? And how do we know that we should be using one?
I'm a fan of these devices when it comes to people that are dealing with really chronic conditions. Usually it's significant challenges with sleep. Mental health issues are very positively affected with these alternative devices and these adjuncts. I'll never say that one of these devices, regardless of which one it is the answer. That's not true in any case, but it's a great adjunct tool to help
Right.
accelerate that process. There are physical stimulation tools that you can use. You can even basically do a physical manual manipulation, very gently massaging over the carotid artery. Your vagus nerve, by the way, courses alongside your carotid artery and jugular vein in front of your SCM. Now the issue is we've learned that deep carotid massage, which used to be a practice completed by uh, medical doctors in emergent situations, they're good, but you can pass out because if you push too hard, you're going to affect your carotid artery. So electricity is a great way to affect the vagus nerve without affecting the carotid artery and the jugular vein.
Okay.
So that's where electricity comes in. Now, there are devices that are known to stimulate the vagus nerve and quite effectively that attach to the ear as well. So there's the auricular branch of the vagus nerve, which is the only skin sensation piece to the vagus nerve puzzle. And there are certain areas. So for those who know acupuncture or they understand acupressure, the Shen Men point and the vagus nerve points, those 2 points are really powerful in activating that area. But you can just use like Q-tip. Don't go in, obviously, but just on the surface of your ear, you can do tragus stimulation. You can just very gently stimulate, or electrical stimulation devices that clip onto the tragus. Great ways to do that. There's a lot of tools that are coming out and lots of different practices. I'm never one to say that there is a single answer for everybody either. Cervical devices tend to require less time. So 2 minutes of stimulation on the neck tends to be equivalent to about 15 to 30 minutes of stimulation on the ear. If you don't have time to do a long term auricular stimulation, then the cervical devices are great. The only people that shouldn't be using stimulation devices on the neck are people that have metal implants or um, pacemakers, things like that. So we don't want to go in any direction where we're affecting that technology or the metal. But outside of that, it's a pretty safe therapy. There's not a lot of negatives that can come from stimulating the vagus nerve. And then there is a really great tool that I've used with kids called the Resimax. And the Resimax is more of a massage tool. And if you just go over the carotids with this tool, it's a great little massage piece, particularly for kids. So those are great little adjuncts.
I'm glad you mentioned kids. So I want to ask you, like, how do you know if your child needs, more stimulation there? And also, I'm assuming we have good vagus nerves, when we're born and as we go along, but with stressors of life and physical and all of that, it down regulates at some point, doesn't do as well as it used to. So as a child, I would assume everything's all good because they're very young. So how do you
Ideally,
know?
ideally.
Yeah.
Um, so I have two daughters. They're 8 and 4, and I can tell you very clearly that the first one is much better at regulating herself than the second one. I think that's a pretty common first child,
Yeah.
second
Yeah.
child
Yeah.
situation, which I'm sure you're aware of. But the dysregulation that you tend to notice ends up being like these tantrums, or you notice that their breath patterns are pretty dysregulated. My 4-year-old has a lot of trouble regulating. And so, what we'll often see is she's breathing through her mouth. She's breathing really fast. She's not able to sit still. She's moving around a lot. Those are things that you want to look for, that, your body is really pushing towards that sympathetic state mode. And one of the things that I like to kind of do with them is teach them how to breathe and kind of being the example with them.
Yeah.
So I have my daughter put her hand on my belly and I show her how I'm breathing. And then I'll put my hand on her belly and have her visualize that when she is taking these nasal diaphragmatic longer exhale breaths with me, that there's some sort of balloon in her belly. She gets to choose the color. She gets to choose if there's a picture of a Disney character like Elsa or somebody on it. And she has to blow that balloon up or expand that balloon out with her inhale and then slowly let it shrink down with her exhale. And doing that visualization practice is a great way to get kids out of their head about the thing that created the dysregulation or the tantrum in the first place, and help them get into their breathing patterns. Now, it's not always going to work. And with my 8-year-old, a couple of years ago, we took her to the optometrist. I have glasses, my wife has glasses. Took her to the optometrist, and they said, I think there's some convergence insufficiency there. Her eyes are just not working well together. So we're going to recommend vision therapy for her. So I thought, let's do this. We'll go through the full vision therapy protocol. It's a 12-week program, tons of really cool exercises, helping to retrain her eyes to work together. And being the scientific, curious mind that I am, I said, let's try stimulating your vagus nerve using very similar device to this one, and electrically stimulate just at night for 2 minutes and help you get really good sleep. But let's see what happens with your vision. And at the 12-week reassessment, the doctor came to me and said, what did you do differently? I've never seen a kid progress this quickly through their 12-week program. And I said, I added vagus nerve stimulation in as an adjunct for her. So in addition to doing the exercise, the Brock string and uh,
Yeah.
the swinging and the throwing the ball off the wall and all of these things where she's learning to use her eyes together again, we're regulating her vagus nerve at the same time to enable that process to occur. I just thought that was really cool. And so we don't keep it up quite as often with her, but the use of the tool is there as we need it. So particularly when sleep goes awry and we have a couple of nights where things are off, let's start stimulating again, and we'll get you into a situation where you're able to get good restful sleep and not need quite as much sleep, and just be able to function at a much higher level because your vagus nerve is working much better.
I love that you mentioned the eyes because at the beginning when you were talking about the areas in your brain and your hypothalamus and all that, that's where all the vision, all synapses, right? And all of
Yeah.
the messages are all in the same area. So, that's a very interesting connection. And I'm definitely going to look into that
And
because,
there's one more
like,
connection there as well that I want to bring up, because people don't think about this, but dry eyes is a really interesting piece to the puzzle here. So, when you have dry eyes, you have a lack of these lacrimal gland
yeah, yeah,
functionality. Well, guess what system? It's not the vagus nerve, but guess which system? Is it the sympathetic nervous system or the parasympathetic nervous system that signals to the lacrimal glands to turn on and create the ability for these signals to come out, for the tears to actually come across? It's the parasympathetic nervous system.
I love that. So, I want to go back to the breath work.
So we're breathing through the nose. Nose is our breathing tube, mouth is our eating tube. We're okay to exhale through the mouth, but inhale should pretty much always be through the nose. The reason for this is we only have nose hairs in our nose to filter that air, to let the air come into the sinuses, humidify, warm it, and allow that air to become the oxygen to be far more absorbable through the lungs. If we breathe through our mouth, we don't filter that air, we don't warm it, And the humidification comes from our saliva and our salivary glands. And how many people are waking up with a dry mouth every morning and they need to get water first thing in to get their mouth working again? That's a whole other issue, because on the oral side of things, we're then affecting bacterial growth because we don't have enough saliva in our mouth. So we shouldn't be breathing in through our nose or through our mouth at all. We should be only breathing in through our nose. In an ideal world, if you're not speaking, you're not talking or singing or doing something oral in the first place, we should be doing all of our breathing through our nose. The second thing is diaphragmatic. So nasal, diaphragmatic, and then longer exhales on the breath.
Right. Okay.
Right?
Tell me, like if you could leave our audience with, a couple of key messages, and also if you can add in like, where do you see vagus nerve science, I want to call it, headed in the next 10 years?
Whew, 10 years is a long time. The overarching take home, I think, from all of this is that healing can't happen when you're stuck in a sympathetic fight or flight state. Your body can't get the healing capacity that it needs unless it enters that parasympathetic mode. And the vagus nerve is the primary connectivity tool for that parasympathetic mode. So, what we really need to do is spend more time there and teach our bodies to enter that mode in order for us to enter healing state. So that's kind of the overarching theme. Now, where do I see this going over the next little while? I see there's a lot of research being done on stellate ganglion blocks, which is a great way to limit sympathetic nerve function and allow the vagus nerve an opportunity to do its work. There are some companies out there that are creating implantable vagus nerve stimulators that more recently have gotten FDA clearance for things like rheumatoid arthritis, and they're looking at Crohn's disease and ulcerative colitis and IBS and IBD. I think there's a vast number of conditions that are going to be positively affected by addressing vagus nerve function. I know that the sister product to this guy is FDA cleared for migraine, cluster headache, hemicrania continua. So we know that there is a lot to this. This is also really good for allergies and asthma and things like that. I think what is going to happen is we're going to realize that we need good, strong vagus nerve function long term. And the science is heavily going to move towards stimulating and activating vagus nerve to address many chronic health conditions in combination with bringing in the right nutrients and getting rid of toxic foods and a lot of things. I think sadly we're going a little bit bipolarized in society in terms of those that are really health driven versus disease focused. And that may be where a lot of the kind of butting of heads occurs. But in reality, what we want generally is we all want to be healthy. And whether it's a matter of lowering disease burden or increasing health capacity and increasing longevity and health span, really, we know that the vagus nerve needs to be functional in order to minimize the risk of disease, and we need to turn it on in order to enable that healing productive capability of our bodies to last. So I really think that it's some form of stimulation is going to become almost standard practice.
And it's interesting because our ancestors subconsciously somehow knew that, but only now the science is showing it years and years later. Thank
Yeah,
you so much, Navaz, for your time today. Can you tell our audience, we're going to link your books and your podcast, but tell our audience where they can find you if they want to reach out to you.
for sure. Instagram is the first place, easiest place to find me, Dr. Navaz Habib. You can go to healthupgraded.com to learn more about the Vegas protocol and the online community and membership. And the books are a great place to start. I know I dug deep in with the science here a little bit, but tried to keep it simple. The books are written in a way that it's accessible for most people. And so if you know somebody that needs support and wants to activate their vagus nerve, the books are a great place to start.
Perfect. Thank you for your time.
Thank you.
Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at dr.Meenal Agarwal. Until next time, keep those eyes uncovered.